1. Iron. The first one is iron, one of the easiest supplements to misuse. You feel tired. You think, maybe I'm low, so you take iron, then stack it with a multivitamin. The problem? Unlike water-soluble vitamins, your body cannot simply pee extra iron out. For adults, the upper safe limit is about 45 milligrams a day. Go above that often, and the stomach usually complains first. Nausea, constipation, cramps, vomiting, diarrhea, even black stools. But the deeper danger is storage. Extra iron can build up in the liver, heart, pancreas, joints, and hormone glands. And in an acute overdose, blood pressure can crash, acid can build up in the blood, and organs can fail. 2. Vitamin A. Next is vitamin A. Just like iron, vitamin A is another nutrient your body cannot simply pee out. Extra vitamin A gets stored mainly in the liver. That is why the overdose usually feels slow. High-dose vitamin A pills, cod liver oil, frequent liver intake, or long-term retinoid medicines can push someone past the adult upper limit of 3,000 micrograms RAE a day. Then hypervitaminosis A can begin. First come the warning signs: severe headaches, blurred vision, dry, cracked skin, hair loss, and joint pain. But underneath, pressure can rise inside the skull, bones can weaken, the liver can inflame, scar, and in long-term cases, take permanent, life-threatening damage. And during pregnancy, too much preformed vitamin A can also damage the baby's brain, heart, and face. 3. Vitamin D. At number 3, we have vitamin D. Vitamin D is dangerous because the overdose is not really about vitamin D. It is about calcium. Too much supplemental vitamin D can cause hypercalcemia, meaning calcium starts building up in the blood. At first, it may look like nausea, vomiting, loss of appetite, weakness, confusion, extreme thirst, and constant urination. But if it continues, calcium can start depositing where it should not. That can lead to kidney stones, deep bone pain, kidney damage, dangerous heart rhythm problems, and even kidney failure. And this usually happens from high-dose pills, not sunlight, because your skin naturally limits how much vitamin D it makes. For adults, the upper safe limit is about 4,000 IU a day. Going above that long-term, without medical supervision, can become dangerous. 4. Iodine and kelp. Next up is iodine, the mineral your thyroid uses to make hormones. But too much iodine can confuse the same gland it is supposed to support. This usually happens from kelp pills, iodine drops, potassium iodide, or thyroid support supplements. For adults, the upper safe limit is about 1,100 micrograms a day. Cross that often, and the thyroid can swing both ways. It may speed up, causing fast heartbeat, anxiety, weight loss, and tremors. Or it may slow down, causing fatigue, weight gain, and cold intolerance. The gland can also swell into a goiter, and in thyroid-prone people, excess iodine can worsen autoimmune thyroid problems. 5. Selenium. Next is selenium, a trace mineral your body needs for thyroid enzymes and antioxidant defense. But selenium has a narrow safety margin. Too little is a problem. Too much becomes selenosis. This usually happens from selenium pills, multivitamins, thyroid support formulas, or eating too many Brazil nuts. One large Brazil nut can carry around 68 to 91 micrograms, and the upper safe limit is 400 micrograms a day. So if you keep crossing that, selenosis can begin. At first, it may look like metallic taste, garlic breath, nausea, diarrhea, hair loss, and brittle nails. But long-term excess can go deeper. Nerves can start tingling or going numb. Muscles can tremble. Breathing can become difficult. And in severe toxicity, selenium can damage the kidneys, heart, and even become fatal. 6. Zinc. Zinc is tricky because the problem is not only what too much zinc does, it is what too much zinc steals. People take it for immunity, acne, colds, or recovery. Then they quietly cross the adult upper limit of 40 milligrams a day. Short-term, the body complains through the gut, nausea, vomiting, cramps, diarrhea, and headaches. But long-term, zinc starts blocking copper absorption, and copper is not optional. Without enough copper, the body can struggle to make healthy blood cells. White blood cells can drop, immunity can weaken, HDL can fall, and nerves can start misfiring, causing numbness, tingling, and weakness. 7. Niacin. Next is niacin, or vitamin B3. Niacin is where a vitamin starts behaving like medication. Your body only needs around 14 to 16 milligrams a day, but some people take high-dose niacin for cholesterol, energy, or heart health, and they cross the adult upper limit of 35 milligrams from supplements. The first warning is the famous niacin flush. Face burning, skin itching, chest and neck turning red. Then come dizziness, nausea, vomiting, stomach pain, diarrhea, low blood pressure, and a racing heartbeat. But long-term high doses can go darker. The liver can inflame, blood sugar can rise, uric acid can increase, triggering gout, and extreme doses can lead to liver failure. 8. Vitamin E. At number 8, we have vitamin E. Vitamin E is usually sold like gentle antioxidant protection, but in high doses, it can start acting more like a blood thinner. That is the danger. Too much supplemental vitamin E can interfere with vitamin K, the vitamin your body needs for normal clotting. So instead of protecting cells, it can make bleeding harder to control. At first, that may look like easy bruising, nausea, diarrhea, stomach cramps, fatigue, or muscle weakness. But the serious risk is internal bleeding, especially if someone is also taking aspirin, warfarin, blood thinners, cholesterol medicines, or certain cancer treatments. In extreme cases, excess vitamin E can raise the risk of hemorrhagic stroke, meaning bleeding inside the brain. 9. Potassium. Number 9 is potassium. Potassium is dangerous because overdose does not always announce itself. No dramatic warning, no instant collapse. It can simply rise in the blood. Healthy kidneys usually remove the extra, but potassium pills, potassium salt, kidney disease, or some blood pressure medicines can push it too high. That is hyperkalemia. At first, it may feel like weakness, nausea, stomach cramps, tingling, numbness, or heavy muscles. But potassium is part of the heart's rhythm system. Too much can disturb the signals that tell the heart when to beat. So the real risk is not just discomfort, it is arrhythmia, paralysis, chest pressure, and cardiac arrest. 10. Magnesium. Magnesium sounds harmless because people take it to relax, sleep, or fix constipation. But too much supplemental magnesium can slow the body down too far. Food magnesium is rarely the problem. The risk usually comes from high-dose pills, antacids, or magnesium laxatives, especially if the kidneys are weak. For adults, the upper safe limit from supplements is about 350 milligrams a day. Cross that, and the gut usually reacts first. Diarrhea, nausea, vomiting, and cramps. But severe buildup can drop blood pressure, weaken muscles, slow breathing, disturb heartbeat, cause confusion, and in extreme cases, lead to cardiac arrest. 11. Vitamin B6. Lastly, we have vitamin B6, the trap in the B vitamin family. People think it is water-soluble, so I'll just pee out the extra. But B6 is different. Take too much for long enough, and it can turn against the nerves it is supposed to support. This usually happens from B-complex pills, nerve supplements, energy drinks, pre-workouts, or stacking multiple products. The US upper limit is 100 milligrams a day, but some regulators set it much lower because nerve symptoms can appear below that. First comes tingling, burning, and numbness. Then balance can suffer. Hands and feet may lose sensation. Legs may feel weak or unsteady. Walking can feel strange, like the floor is not giving proper feedback. And even after stopping, nerve recovery can take months. 12. Omega-3. Omega-3 is tricky because it has a clean reputation. Heart health, brain health, inflammation support. So people keep adding more. But high-dose fish oil is not just extra healthy fat. It can change how the blood and heart behave. Go too high, especially above 3 grams of EPA and DHA a day, and bleeding risk can rise. Nosebleeds, bleeding gums, easy bruising. High doses may also increase the risk of atrial fibrillation, where the heartbeat becomes irregular. Then come the everyday signs: reflux, nausea, diarrhea, heartburn, and fishy burps. And if it is cod liver oil, too much can also stack vitamin A toxicity. So the idea is simple. Supplements are not the enemy, but guessing is, because a deficiency can hurt the body, and so can excess, especially when doses quietly stack through multivitamins, immune boosters, energy drinks, and hair supplements. That is how B6, zinc, selenium, or iron can climb higher than you realize. So test before you start, retest after, and use guidance instead of guesswork. because the right supplement is not the strongest one. It is the one your body actually needs.